Hey, Alyssa.
Hey, Sam.
How are you?
I'm feeling, my eyes are already watering. What is wrong with me these days?
Why?
Because I'm feeling excited about 2020. I woke up in a great mood. I feel like I have great friends, great family. I don't know.
Oh, wow. This is, I think, the quickest eye water of all time.
How are you?
It's making my eyes water just looking at you. Yeah, I'm good. Today is officially the new year for us. I mean, by the time that these are going out, obviously it's going to have been the new year, but,
yeah.
but it's fresh.
It's fresh for us. Yeah. Did you stay up for the countdown?
We were up, but we weren't I heard fireworks and I was like, Happy New Year's, babe. And that was pretty much the end of it. It wasn't a thing.
Married life.
Yeah, pretty much.
Cool.
Yeah. Are you ready?
I am ready.
All right.
Sorry, that was a long intro.
It was. Do you wanna
Kick this off?
Yeah.
Yeah, okay. So today's episode was actually sparked a long time ago, I feel anyway. I was in the walk-in clinic and I was reading Reader's Digest, and if some of you remember, Sam really made fun of me for reading Reader's Digest back in season 1.
And look how that's come to fruition for us.
Yeah, exactly. So you're welcome. And I was reading this story about a woman named Katie Luciani, I think is how you pronounce her name. And she was talking about her experience with endometriosis and how she was misdiagnosed. For years and years, she lived with this immense pain, and doctors just kept sending her away. And it really got me thinking, and this was before the podcast was even out. And I wrote it down in my notes, and then Sam had come across another thing in the similar vein, and so we decided to talk about the ways in which sometimes doctors have wronged us.
Yeah.
And I kind of want to preface this episode by saying I do have immense respect for the medical community.
Oh, of course.
I do, I can't even fathom the amount of education and dedication and emotional strain that being anyone in the medical so I do want to say that, but I do think that it's crazy how many times I at least have been wronged.
Yeah. It was interesting. Okay, so I was doing some research about the racial disparity in terms of healthcare, and then started reading some studies about gender equality issues within healthcare and how healthcare is being provided. And when you're talking about Katie, one of these studies that I was reading was basically talking about how due to social bias, women are often disregarded when it comes to their medical issues because we're seen as being emotional and hysterical and all this kind of stuff, and men are taken as being they're taken more seriously because they're seen socially as being stoic and not as willing to admit to weakness and vulnerability and all that kind of stuff. So the problem that we're having is that there's so many diseases that predominantly affect women that are under-researched because they're not seen as being as big of an issue. So when things like endometriosis are brought to doctors, a lot of the times they're kind of explained away as being hysteria, and again, we're going to be talking in general terms, but we're of course not generalizing the medical profession. Yeah. But a lot of things like that predominantly affect women are kind of explained away because the symptoms aren't immediately recognized. They aren't able to be it isn't as clear how to treat and recognize these things by doctors because they're so under-researched.
Right.
Which is just it's crazy to think that, regardless of how educated you are as a doctor, that social biases are still impacting people that much, that it impacts their ability to do their job and care for people. Yeah. It's really sad.
Do you feel, I don't know what kind of question this is, but do you feel like you're more respected by female doctors than male doctors?
I was going to ask you the same thing. And yeah, I do.
Do you?
Yeah.
I don't.
Really?
Yep.
Oh,
it's
funny.
Literally so wild. Most of the male doctors that I've had have treated me with more respect and have taken my symptoms more seriously.
Interesting.
It's so wild. I don't know what it is, but the female doctors that I've come in contact with are often, they try to explain away my symptoms and make more mistakes in my experience. Yeah.
That's so, yeah. Almost every male doctor I've ever had, I've left feeling uncomfortable or dismissed or whatever. I can't really recall an experience with a male doctor where I was wow, he did a good job. I've seen male doctors and male nurses care for other people well. Like my dad and my brother were both in the hospital for extended periods of time, and I saw a ton of like male employees like work really, really well with them, and were super respectful, really kind, really like fast with helping them and all that kind of stuff. But I've not had that experience. And I think that I don't know, like I do feel like my symptoms have been kind of like explained away. Like at one point I was having like kind of like heart palpitations and stuff like that. And every male doctor that I went to, which was like several, because I kept getting referred to like the next level of whatever, like I had to go do like an EKG.
There's both, and I never know which one I had either.
Okay, well, like a heart monitor or whatever, and I had to do that. I had to do a stress test where like I had to run on a treadmill. I had to do like these brainwave things where they stuck fucking things to my hair with a sticky shit. I had to do like a bunch of different testing, and every single male doctor that I had was like, you have anxiety. Mm-hmm. And then I went to a female doctor that was like, she was the last person I ended up seeing. And I was like, a lot of people have told me that this is anxiety. And she was like, it could be anxiety, but why wouldn't we explore all the other options first? Mm-hmm. And I was like, thank you so much.
Yeah.
I appreciate it. Because like the thing is like, if it's anxiety, and not that I don't think that those people are qualified in giving me that diagnosis, but if it's something more severe, mm-hmm. I'd just like to know, or know that it's not, you know? Yeah. But tell me about some of these experiences you've had with women.
Well, my first displeasure occurred when I was really, really young, when I fractured my back. So I honestly don't remember how old I was, and I don't think my mom does either, because I was so young, but I think I might have been like 7 or 8 or 9 even. I don't even remember. Anyway, when this happened, and I was on a trampoline, and anyway, I was doing a back bridge, and it fractured my L5 vertebrae. And my mom had taken me to the doctor, and the doctor didn't even order an x-ray. And I couldn't sit at the table. I couldn't really move. Like I could move my legs and stuff. Like I wasn't paralyzed, obviously, but it was wild. Like even like thinking back, because I was so young, I was like, the pain that I'm in must not be that severe.
Yeah.
Because everybody was like, just take a Tylenol sort of thing. And so I was like, oh, well, this just must be pain. But looking back at that pain, and because I refractured my back in grade 10, and I felt the exact, like, it's so, yeah. It was the exact same pain. And I was like, what? And like, I was expressing, I feel like very verbally, the pain that I was in, and they didn't order anything.
I'm curious too, like how many cases of kids not being taken seriously, like if that's a thing as well, and I'm sure it is.
Sure.
Which is like so sad, because like like obviously like you have to be an advocate on behalf of that kid. Mm-hmm. Like they can't really fend for themselves.
Yeah.
You know?
Well, and my mom harbors a lot of guilt for that as well, because she did advocate in the way of like physiotherapy and stuff like that, but she didn't.
But
like,
even like the doctors, I mean, advocating for you.
Yeah. And it's funny, well, not funny, but interesting. I had gone to the walk-in clinic when I was maybe like 12 or 13. I was very independent, like as a kid. And I had gone because I was having ear pain, because I have like, what's it called? Like ear canals that go like up and down. They're not like straight. And so I get fluid in my ears, and they were like, other than this, like, how are you feeling? And I was like, oh, well, my back hurts, but like it always hurts. And they were like, huh? And I was like, oh yeah, I've had it like since I was a kid, like it. And I explained my pain to them, and they were like, you need to go get an x-ray. Like this is not normal. And I took that x-ray sheet and I threw it in the recycling, because I was like, no. Because I was like, oh, well, like this is a thing. Like I just have this, like my back always hurts. You know what I mean? Like
it's been taken care of.
Yeah. But it's interesting that like, because I was there by myself, whatever, I was just like, oh, but had I gotten that x-ray, I could have like started dealing with my issues like sooner.
Yeah.
But yeah, that doctor wronged me in so many ways. I can't even begin to tell you. I had, so that was like my first one that I just feel really wronged by. And honestly, I don't know if it would have done any different had I gotten an x-ray sooner, because
so hard to say.
The only thing is it healed without me resting it. So I don't know if a lot of the other problems with my spine kind of like stemmed from that, or like arthritis, because I have arthritis in my spine as well. Who knows? But yeah, that one really fucking pisses me off.
Well, and I think that that's like this is like such a huge issue to me, because I feel like so many people probably go to the doctor because obviously we don't know better. That's why we're going to a doctor. So it's like, I think that so many people probably do that and go there and have their symptoms kind of explained away. And they're just like, well, guess that's that. And they just assume that, because I don't know what your symptoms are like. I don't know what you feel in your body. So what's normal to me is normal to me, and vice versa. But there could be like a huge disparity between that. And I think that that's so horrific to think about, that there's so many people living with like less than health when it shouldn't be that way.
Yeah, well, and with my back pain, because it was so bad for so long, I ended up getting prescribed naproxen or naproxen, and that's an anti-inflammatory. But I had been tested for asthma, and I have asthma, and and those two things, like you shouldn't be taking, I think they're called NSAIDs, with asthma. I mean, I don't know if this is true. It's what doctors have told me, but and that same doctor prescribed me that medication without even taking into account my asthma. And I mean, this is something as well, is doctors prescribe you something because they think that the benefit is better outweighs the risk, which I agree with for sure, especially like with side effects and stuff like that. But I would be going up the stairs and I couldn't breathe, and I would just be sitting there and just being like like, and for like years, and my mom was like, something is wrong here, like you're not usually like this. And I stopped taking the naproxen and it went away.
I was just thinking while you were telling that story about how many times like I've been prescribed something and they didn't tell me anything about that drug. And it hasn't been until like very, very recently, like honestly within the past year, that I've actually gone and looked up these things myself. I think that like from what I gather from talking to Americans and stuff like that, a lot of Americans are more likely to go and research things themselves, because like obviously free healthcare is like a thing in Canada. So I think we just like have such just like unrelenting trust. But I, for the longest time, never looked up side effects. And so when it came to like my birth control, I had been on birth control for several years. And when I went to go look up the side effects finally of that, I was like, holy fuck, like this is so much of what I'm dealing with. And one time I get like incredibly bad anxiety when I go to the dentist. I fucking hate it. And this doctor had prescribed me something to relax me, basically. But when I went to go look up this thing, it said like, don't take if you've like drank any kind of citrus juice, because it could like kill you or some shit, like, or like give you seizures, something fucking crazy, like some really, really like intense reaction to like citrus. And I was like, what the fuck? I'm like, why wouldn't you tell me this like at the doctor? Like why wouldn't you tell me that like I can't, what if I fucking wash this down with grapefruit juice? Like, and it's just it's bizarre to me that they don't really discuss that at all. Yeah. A lot of the times. I just feel like I've been prescribed things so many times, and like antidepressants over the time of me going into the doctor for depression and stuff like that. I've been prescribed so many antidepressants where they aren't talking to me at all about any of the symptoms, what I can take it with, what I can't, like when I can take it, when I can't take it, like all that kind of stuff. It's just, it's bizarre to me.
Something that really bothers me is when I see those memes and stuff like that of like the people saying like, oh, I Googled my symptoms, and then it's like a meme of a doctor being like, oh, like fuck my like 6-year degree or whatever. The thing is like, we have all of this information, and I think that the danger of looking up your symptoms and stuff like that is that you can catastrophize a situation. I agree with that. But there are a lot of level-headed people out there who can maybe make sense of what they're feeling and then go in armed with like what they think is like a good action plan. Do you know what I mean? Like, like I've diagnosed myself with so many things that doctors didn't even like think of. Yeah. And then I brought it to them, and this is the thing, is I would always say like, I'm just wondering, because I'm not qualified, and like Wikipediaing my symptoms is like, I understand that it's more like a precursor thing that you can't really like put all your eggs in, but then I tell them and they're like, oh yeah, well let's test you for that, and then it comes back. So it's like, I think that there is a lot of merit because you know your body.
Well, and I think that's the thing, is that one thing that I will say, and I'm probably going to relate back to depression a lot because that's like my major like thing, but like one thing I will say is that there's symptoms of depression that I didn't even recognize as symptoms. And I didn't know that until I researched it. So, for instance, like I could have gone into a doctor and just said, like, I feel unmotivated. And they could have been like, well, that could be a million things.
Yeah.
But there were so many symptoms going on that I wouldn't have even thought to mention because I didn't know they were symptoms. So me having researched that, like, myself initially helped me to then go in and be like, okay, this is a symptom, this is a symptom, this is a symptom. Like, none of these things are normal now that I'm looking back and being able to relate it. And I agree. Like, I don't think there's any harm in that outside of, you know, like you catastrophizing things.
Yeah.
And also like researching things after the fact. Like, I really, I feel really strongly about that now. Every time I'm prescribed something, I go home and I research it and I look it up and I'm like, okay, is there anything that I should know about this or that could affect something that's already like an issue for me or whatever? Because, and I mean, I think that a lot of the times it has less to do with doctors and nurses not caring and more to do with the fact that they're just so overrun with work and they have to like work through people so quickly and stuff like that it's like what do you do with that time?
Well, and things like with walk-in clinics, or in the States I think it's called urgent care, what I read in one walk-in clinic was that they have 10 minutes to see you, hear your symptoms, write down your prescription, print it off, and then make notes, and they still have to read your chart all in that 10 minutes. It's like, how could you possibly?
Yeah.
And because that's all of the time they have based on the staff that they have. And I wonder if it is, because I don't have any knowledge about the States, unfortunately, but I wonder if it is different in the States because it's like patient paid, I guess, for lack of better terminology.
So they're trying to pump through people.
Well, but not even, but that's interesting. But I was thinking maybe they have more staff because they get paid more if they get through more patients. But I don't know, because I know that in Canada, the walk-in clinics are always so full.
It's brutal. You know what I was just thinking too? If the walk-in clinics here were called urgent care, I would never fucking go. Because like that to me sounds like, because like for Canada, it's like we have walk-in clinics and then you would go to the emergency room if it was something like severe, which is like you actually going to a hospital. But I feel like it takes quite a bit for me to go to the emergency room.
Oh yeah.
But the walk-in, like I'm fucking there every other day just for shits. Like I go in there all the time. Like
not literally just for shits,
not,
but like
but like I go in there, you know, like if I've had a cold that's persisted for an incredibly long time, that like realistically it's probably going to pass kind of thing. Like I go in just to be sure basically about things that like have been bothering me for long enough to like warrant a visit. But I don't know that I would if it was called urgent care. Like I think that would deter me massively.
I honestly, because I've been sick for so much of my life, I don't really go to the walk-in clinic unless I know I need medication.
Yeah.
Like that's all that those doctors are for me at this point, is like a pen and paper.
Yeah.
Because I just need you to write the prescription. I honestly could basically tell you what I need because I've had the same like sicknesses
for so long.
Yeah, I'm just like, okay, so I need penicillin or I need Biaxin or I need like whatever it is, if I have a sinus infection or whatever. So it's basically just like a means to an end. I'm rarely searching for
an actual answer.
Yeah, information. I really already have the answer. If it was something new, then for sure.
Yeah.
But often it's just like, oh, this old pal back again.
Back from the dead here.
Good old strep throat.
Fuck man, strep throat is the worst.
Yeah.
Brutal.
I've been to the hospital a couple times for strep throat.
It's to the hospital for it.
Yeah, because my fever gets so high and we can't bring it down. Like 104 type of situation where like my veins literally collapse because I'm so dehydrated and like my muscles start like seizing. And yeah.
You are like a delicate peach.
I know.
You're like, we're not dealt the health cards. I'll say that.
There was one time my mom called the ambulance because it was Christmas. And I think it was actually Christmas Day, and I had strep throat so bad. My fever was at 104. And she was scared to bring me out into the cold because I was so hot that it would like, I don't know if it would have caused a seizure, but that was her concern. And I was begging her not to call the ambulance because I thought they would think I was faking it.
Oh, wow.
She's like, you can't fake 104-degree fever. And they put in the ambulance, they put the, I was so delirious, but they put the IV in my arm and it was like hitting me in the face. like, because she was like trying to do other stuff. And then she looked back and she saw it like hitting me in the face. She's like, oh, well, that's not what you want. And I was like, it's a minor inconvenience.
It's fine.
Just so funny. Oh my goodness. What a hoot.
Do you think that like you were then like after that initial experience that you had with that doctor with your back, do you think that you were then like as a kid less likely to go get help?
I don't think I really put two and two together for a long time. It took a long time for me. That person was my doctor for like years.
Oh, wow.
Even after that. It took a really long time for me to be like, oh, there are doctors that are not like this.
Yeah.
But no, I didn't really go to the doctor because, well, I was sick of going to the doctor because I was there all the time because I had so many different, like, I was always sick or it was always something with my back. So I was going to like get MRIs. Like once we finally figured out that like what I had done was fractured my back, I was like going to get MRIs and bone scans and CT scans. And then like with my tonsillitis or my strep throat, like I was always in an appointment. Physio. I tried chiro. You know what I mean? Like I was always there. And I had written my mom a note at one point saying like, I don't want to do this anymore. Like stop scheduling me doctor's appointments. Like I just want, because I did go through a very short stint of, I wasn't diagnosed, but what my mom feels like was depression when I refractured my back in grade 10, and I just didn't want to do it anymore. Yeah. I was just like, I can't, like, this is miserable. Like I couldn't do anything a kid was doing. I could just lay in bed. And then finally, like I met you guys and my girlfriend came and I got out of it, but
and everything got better.
Yeah. But yeah, it just became like, and I can't even imagine, like, this is the thing is like, that was so much less. I can't even imagine having like cancer as a child. Cancer ever, obviously, but
yeah.
But in those like little moments, even when I was when I had that really bad fever and I was in so much pain, I was like, in that moment, I was like, I understand why people just ask to be like, I don't want to just do this anymore. Because it's, and that is nothing compared to like what my dad went through or whatever, right? Like I just understand so much like the feeling of like, I just want to give up.
Yeah. But I mean, yeah, that's the thing is that it's just like, is it, I mean, obviously this is like personal, but like, is it a life to just constantly be sick and be more sick trying to take care of yourself? And that's kind of how it feels sometimes when like you're on medication and it's like, it gets so much worse before it gets better. And it's like, is this going to outweigh the bad? And like, it's just, it's so horrible. I was going to say, when you were talking about like how with your normal doctor, and then you were like, I didn't realize that there was like doctors that weren't like that. I think I might have told this on the podcast before, but there was this one time where I was having like a lot of difficulty having sex. Like it was really, really like incredibly painful. And I had never like experienced that before. And so I had gone to this one doctor that was downtown, and it was like a women's clinic. And this doctor was like so incredible. She did like so many different tests for me and stuff like that. And I kept coming back to her like over and over again. And even just the questions she was asking me, I was like, wow, like the fact that no one's ever asked me this before. Like she asked me if I was like sexually active with multiple partners. She asked me if my partner was like born male. She asked me if if I was comfortable with that partner, if I was comfortable talking to that partner about sex, if I was comfortable asking them about like their previous partners, if I was comfortable asking them if they'd go get tested. Like it was just incredible to me to like actually sit down and like have someone be that thorough that they're like asking all of these questions. And when she was asking them, I was like, these are important questions. Yeah. Like, it's crazy that I've never been asked this before, because they do matter. Mm-hmm. And then eventually we had done like a whole like STD scan, like all this different stuff. And finally on my like last appointment with her, she was like, do you feel completely comfortable with this partner? And I was like, no. And she was like, stress does weird things to the body. And she was like, I think, if this continues, like we can continue to try and figure stuff out if you want. But she was like, if you do end up like being active with another partner and this persists, absolutely like come back. And she was like, but if you don't, I wouldn't be surprised like if this didn't continue to be an issue with like a different partner. And it wasn't.
Yeah.
And even that because like I didn't feel like she was writing away my symptoms immediately. She went through the testing with me, and then at the end she was like, you know what, like all things considered, because everything's coming back inconclusive, maybe it is stress, maybe it is like an issue. And that to me was like, it really just like opened my whole world up medically, because I hadn't considered that, you know, that could be such a huge factor for me, because that pain was like, it wasn't in my head, like it was like intense and like so painful. Like I basically couldn't have sex. And yeah, it was so crazy to me having that experience with a doctor and being like, wow, I've not ever experienced care like this before.
Yeah,
it kind of makes me sad. And
it's so it is sad. And it's amazing when you do find doctors like that who truly, I feel like these are the people who love their job and who are in it to get answers. Do you know what I mean? And maybe they have the luxury of being in a clinic or something like that where they can take the time to explore it.
Yeah.
But it does make such a difference. And like, what a revelation knowing that your body can like basically physically reject somebody else.
Yeah.
That's unreal.
Yeah. Well, and at one point too, because like, I think that, like, especially with seeing like my brother in the hospital, because he was in there for so long and went through so many different types of care. It was just interesting to me to see the impact of like bedside manner. And that same doctor at one point, like kind of like when we were like halfway through like the appointments, she said to me at one point, she was like, don't worry, like I'm not going to give up on you. And I was like, thanks. Because like it was really frustrating for me to like keep coming back and have her be like, it's not this, like it's not this kind of thing, and feel like, but this is still such an issue for me. Like this hasn't subsided for me at all, even though it's coming back inconclusive. And so it did like mean a lot to me, even though, you know, like it's not necessary for her to be like emotionally supportive, but like it meant a lot to me for her to just say that and recognize that like this was obviously an issue for me, or I wouldn't be like coming in for it.
I feel like I mean, this is just from me watching medical drama shows, but I feel like it is actually part of doctor training, is it not, to have bedside manner?
I'm not too sure.
I thought it was, because then the patient will be comfortable with you.
I mean, I think bedside manner can mean different things, because there's one thing with like being like respectful and professional and stuff like that, but I think like that emotional you know, support is different from that. Yeah. But yeah, it was crazy, the difference like with Aaron in the ICU and stuff like that. There were some doctors that were just so fucking blunt and so cold, and it's like not my kid, my parents, like, but like my parents being like, this is our kid, you know, like our kid's like on his deathbed basically, and he's non-responsive and he's whatever, and like you're being so fucking cold. Like it's crazy how like just kind of insensitive people can become to that. Yeah. But I mean, if you're around it all the time.
Yeah. It was so interesting watching my dad go through that as well for such a shorter amount of time. My dad was only in the hospital for like 10 days, I think, 7 to 10 days. I can't remember. It was crazy watching in this experience, the more seasoned nurses be so much worse to him.
Yeah.
And just when he was saying, no, like, stop, that hurts or whatever, when they were trying to flip him, and I yelled at a nurse because she wouldn't stop touching my dad. And I was like, does this really matter? And she was like, well, I have to flip him or else he's going to get bed sores. I'm like, lady, this guy's going to be dead in 3 days. Okay. Like, that's really blunt of me to say, but like, I was never naive to the fact that my dad should have been in hospice even. I'm like, do you just stop? Like, he's in pain. Yeah. And then I had a male nurse come in, and I think he was about my age, and he was so sweet. And my dad was saying that it was hurting when they were putting his morphine in. And I mean, you can never know what the patient's feeling. And the other nurses would say, like, it's all in your head, like, whatever, like, you shouldn't feel pain from this. And instead, that male nurse sat there with the syringe, it's so little, with the syringe, and like, like painfully slow, just like so slowly put in the morphine. And my dad was like that, I didn't feel that. And I'm like, just like, instead of using the knowledge that you have from your textbooks being like, this shouldn't hurt a patient. Yeah. He was just like, okay, I'll take you at face value that this hurts you, and I'll take the extra time to make sure you're comfortable. I could cry talking about it because he was so...
I could cry talking about it.
Because he was just like the compassion.
Yeah.
Right? And even one of our friends that we went to high school with had come up to the floor that my dad was on She was a nurse at the same hospital, and she came up and was like, "Hey, Steve, how you doing?" And was like checking his saline and stuff like that, and just being so sweet. And it was so crazy to watch this girl who, I mean, she was so different in like friendship and stuff like that than she was in that moment. Like she was a nurse.
Yeah.
You know what I mean? And she was just like talking to my dad as if he was like you or me sitting right here. Whereas, I mean, he was, you know, very, very sick. Yeah. And I was like, what compassion to just treat him like the same human being that he always was when we were growing up and he was driving us to the mall.
Yeah.
You know what I mean? Like, it was just so, I think, that's the thing is like there's peaks and valleys in everything, but it's so crazy to be witness to those experiences.
Yeah. Well, and I think that it is so hard because like I understand that it would be so hard to not eventually kind of lose a little bit of that like sympathy kind of thing when you're doing it day after day, and it's hard being a caretaker. Like I completely fucking understand, like that's really, really difficult, and I can't imagine having that as like a full-time job and trying to be still so like pouring your heart out for every patient. But I think the thing is like even though it's not new to you, it may be new to that person. And so for me, dentist and shots, okay? Just thinking about getting shots or getting my blood taken, I could cry just thinking about it. I fucking hate it so much. I get so anxious. My heart's like beating out of my chest. I like cry almost every single time, not because like it hurts or whatever, but just because I don't know what it is. It's like it is mental, but it's terrifying to me. And there's some doctors, I've had to do like an odd amount of blood work, but there's some doctors that were just kind of like an asshole to me about it, and they were just like, "You're fine." And then there was other nurses and doctors that were just like so pleasant and so sweet and like just almost like I'm like a little kid, not like patronizing, but they're like just trying to like talk me through it and like ask me things while they're doing it. And this one nurse was like so fast, like she was so quick, and she was just like, "You're doing great, you're amazing, oh my god, you did so awesome, blah blah blah," whatever. And she put a little band-aid on me, and she was just like so kind to me, and I was like, I do appreciate it because it does make a difference for me. Like, and if someone's just like being cold and rude and shitty to me, it's a lot harder for me to like actually get through that experience with any amount of like sanity left and dignity. Like it's so, I don't know. It's just, I understand, but at the same time, like it's crazy how much of a difference it makes for people to just be, you know.
Well, I think that because I actually have quite a few people in my life, in my past too, who are nurses, like RNs or LPNs or whatever. So I feel like I know the stories of how hard they have to work, that like those stories of like nurses not being able to go to the washroom because they just have more like rounds and stuff like that to do, working like 14, you know, like the crazy shifts and stuff like that on their feet, whatever. It's all true. Yeah. And I think that there's a lack of praise for the people who actually do keep it together. Do you know what I mean? Yeah. Like they keep their spirits up and are constantly kind and whatever. And I think that you're always allowed to have a bad day, of course. Like that's any profession you're going to. But I just want to like send a big shout out, I guess, to like,
we're just writing thank you notes to all these hospitals around us.
Hey, when I was in the ICU, there was this one nurse who, when I got out, like I still think about her. To this day, I think about her because she was so kind and compassionate. And I had actually like asked to have her as my nurse like the whole time. And she was like, "Okay, well, like I'm on night shift next week, but like that's okay. I can be like your night nurse, and then I can be your morning nurse. Like I'll get asked to be assigned to you and like all this stuff." And I'm just like, I still think about her, and I don't know her name. I can't remember because I was fucking in the ICU. Yeah. And I wanted to like write her notes and like letters and like send her a Christmas gift and stuff like that. But like it's crazy how much these people can truly change our lives. Yeah. You know,
there's this viral video where I guess this girl had some kind of accident. She was in a wheelchair and she wasn't able to walk and stuff like that, and there was this video where she's like wheeling in her wheelchair to like say hi to this nurse again, and the nurse is like, "Hey baby, like, oh, I'm so excited to see you," and then she stands up out of her wheelchair because she actually like learned how to walk, and she's like, like the nurse went like crazy, and she's like, "Thank you, God, thank you." Oh my god, I cry every time I see it because it's just so sweet. Like you can tell this nurse just like care. You can tell this nurse just like cares for her so much and was like genuinely so excited to see her rehabilitated. Yeah. And it's just, it's very heartwarming when it goes right.
We're like, this is how doctors have wronged us. And we're like,
this is how they've righted us.
Yeah. I have had some bomb nurses. I had one shitty one, but fuck her.
I mean, There's a bad apple in every bunch.
Yeah.
Unfortunately.
So true. Okay, so moving on from that eye water, what are some ways that, what are your experiences with doctors?
Okay, so exclusively bad experiences with male doctors.
Wow.
One time I went in to get birth control, and this guy told me to go get it from Planned Parenthood unless my boyfriend had deep pockets. That was really hurtful.
Is that a direct quote?
Yes, that's a direct quote. And I was like young too. Not that it matters. It shouldn't matter how old you are, but I was like 19. And then another doctor, and this was actually, I'm pretty sure, my dad's family doctor, because I was living with my parents at the time and I didn't have like a doctor here. And my dad had said like, oh, just go to like my family doctor. And again, like I think I was going in for birth control or something like that. And this doctor was like, when was the last time you had a pap test? And I was like, oh, like 6 months ago. And you only have to get them like every 3 years. And he was like, well, we should do another one. And I was like, oh, why? Like, I was like, I've been on this birth control. Like, I know that it's fine. I was fine in my last checkup. Like, I've been on this birth control for like a few years. And he was like adamant about doing a pap test. And I was like, well, I can go to another clinic. Like, I'll book somewhere else, because like I wanted to book with a female doctor. And then I can't remember what his exact words were, but he made some kind of comment basically alluding to like, because I had like red, like dark hair at the time that was like clearly dyed. Mm-hmm. And he made some kind of comment to me about like my hair and pubic hair, some kind of like weird fucking comment like that. And I was like, okay, well, see you later.
Are you joking?
Dude, it was so bad. And like, I can't remember, because I was actually telling my mom this story like 2 days ago. I don't know why we brought it up, but I was talking to my mom about it, and she was like, did you tell your dad? And I was like, I can't remember, honestly, because I think I was so embarrassed.
Yeah.
And I felt like, I don't know, like I think I felt uncomfortable like telling my dad that had happened, which is so backwards, obviously. But that happened. And then another time when I was dealing with the like heart issues, I had gone into this one doctor, and he was like checking out my chest and with like a stethoscope or whatever. And he was like, have you had any surgeries? And I was like, no. And he was like, you've had no surgeries. And I was like, I had like gum surgery when I was 11. And he was like, no cosmetic procedures. And I was like, no. And then he was like, have you had breast implants? And I was like, no. I was like, oh my God, dude. I'm like, do you not think I would have mentioned that like in the last 4 times you asked me? And like, it made me so uncomfortable, because it's like, I understand why with like the issue that I was experiencing at that moment, right, that would be relevant. But it's just like, okay, dude.
Yeah.
How many times do I have to tell you no? Like,
yeah.
I know they look fantastic when I'm laying down, and they have a lot of like perkiness when I'm laying down. I get it. But like, I was just like so uncomfortable, because especially because he was male, it's just like, I don't know. It just made me feel really weird. So those are some of my stories.
That just made me think, sorry. I'm so annoyed. That made me think of my recent ear, nose, and throat doctor who called me a drug addict.
What a guy.
And asked me, I don't know how many times, if I was participating in the drugs. And I said, no.
Are you participating in the drugs?
And he said, not even on the weekends? Nope, I'm sober. Not even here, not even there, not even once. I'm like, dude, I've told you my entire history.
Yeah. I
literally just told you that I've been like sober from even alcohol for, at the time, I think it was like 6 months. I was like, stop.
Yeah.
Like, I don't have, this is like, just fuck off, man.
Yeah.
You know what I mean? Like, take me for a drug test then, but stop like condescending to me.
People have been the same with me about drinking, because I don't drink. Mm-hmm. And anytime they're like, do you drink? I'm like, no. And they're like, so how often? And I'm like, never. And they're like, when was the last time? And I'm like, 3 years ago. Like, I don't like literally never. And they just like will not believe it. And I'm like, I don't fucking drink. Like, yeah. And if I was to tell you otherwise, it would be to my detriment. You know what I mean? Because like that's not a contributing factor to whatever is going on here, obviously. So yeah,
a friend actually asked me last night because he had thought that I was sober for like 2 years, and I was like, oh no, like it's only been 7 months. And he was like, oh yeah, but Sam doesn't really drink either. And then I'm like, no, not really. He's like, just like once in a while. And I was like, no. And he was like, well, no, like she was like drinking at her husband's birthday. And I'm like, no. He's like, I thought I saw her. I'm like, that was a Coke. He's like, really? And I'm like, okay, I was trying to think of like when the last time you had a drink was. And I was like, well, She had a margarita 9 months ago. Like, that was literally the last time that you had a drink, I'm pretty sure.
Yeah. It's not often. It's not often. I think that I had a drink. I mean, I'm sure I've had a Bellini here or there. Matt last night, we were at this restaurant a couple days ago, actually, and he was like, "You didn't order a Bellini?" And I was like, "No." And he was like, "Well, this restaurant serves Bellinis." And I was like, "Yep." Mm-hmm. And he was like, "Well, that's how, like, I know that, like, restaurants serve Bellinis is because you order them." And I was like, "Matt, I don't order Bellinis that often." I'm like, if this is like your indicating factor as to what's on the drink menu, like I'm gonna ask you to get something more legit to like narrow this down. It was so weird, but I was like, I've ordered a drink around Matt, especially like maybe twice.
Yeah.
I really don't. Like,
I feel like when I was still drinking, you probably drank like the most that I've ever seen you, which was still like once every maybe like 5 months. Because I would always be drinking and I'd be like, just get a Bellini maybe, and you'd be like, drink like one sip of it.
Yeah, I don't like enjoy it. Like, the thing about a cola beverage is like it's just so satisfying to my sensibilities, and like Bellinis are like delicious, but then like when I it's just like I can't like sit there and slam it, you know?
Yeah.
I don't know what to tell you. So let the record show, doctors, I do in fact not drink. Did you know, let me just bring up my statistics I've written down here. Okay. In the US, there's a lack of studies in Canada regarding this. Black women are 3 to 4 times more likely to die during childbirth. And it's been estimated that most of those could be prevented. And it's about the same for Native American women and Alaskan Native women.
And which?
Alaskan Native women.
Really?
Yeah.
Do they say why?
Just like racial bias.
Racial bias, yeah.
And so it kind of like went into the same thing. Like, they talked about Serena Williams' birth experience because she like had a really like scary like issue happen with her birth experience. And she had told them that like there was an issue happening because she knew that this was something she dealt with previously. And they pretty much just like wrote her off and didn't like care for her immediately. But yeah, it's racial bias because they think that like they don't take them as seriously. These like women are historically undervalued. And so they're not cared to as quickly in a lot of cases and stuff like that. And I just can't even imagine, because like I'm so terrified of dying in childbirth, that like, can you imagine going to the hospital already scared of dying of childbirth? Because I think that's pretty common. Like, a lot of women are like scared of childbirth in general. Like, that's a scary thing to have happen or to do. But then to have to go in knowing that like
you're 3 to 4
times more likely to fucking die just because of like your race, that's horrific to me. Like, I just can't even imagine how terrified I would be.
That makes me so angry.
Yeah.
I was just trying to think about it, and I literally don't have any words other than that makes me so frustrated and angry.
Yeah. It's really sad. But I think, you know, it's talking about, you know, the disparities between like race and gender issues and stuff like that as well. It's, again, just crazy how much that societal kind of construct and these issues that like live in our society, how much that can play into all these different scenarios, that it's just so harmful and so dangerous and so terrifying. Like, I just can't even imagine. And I don't know. It was really sad reading those studies.
Yeah.
Just I can't imagine being in that scenario and already being scared, and then on top of that trying to advocate for yourself and still being kind of like just like written off, like when it's dire, you know? I just, yikes.
Well, and this is something that I know absolutely nothing about, which is why, you know, I don't talk about stuff I don't know about. But even thinking about that and how angry it makes me, I can't even imagine outside of places like North America and Australia and stuff like that. And
yeah.
You know what I mean?
Yeah.
Like in other countries.
Interestingly enough, it said that the U.S. has the highest maternal like death rates out of like industrialized countries. Isn't that crazy?
Yeah, but somehow it actually doesn't surprise me.
Yeah.
It was really interesting. I got this is more so just like a story time, but it was interesting. I got really bad food poisoning. I think it was salmonella. I can't really remember because going to the doctor in Central America is like so different. But I'd gotten really bad food poisoning and I had to go to see the doctor. But you actually like oftentimes go and just see the people at the pharmacy. I did this
Oh.
I did this in Nicaragua, and I also did it in Guatemala because I was like really sick, like really bad. And I had to just like translate my symptoms to them, and they just gave me a bunch of these pills. And these pills that they gave me, even when I tried to look them up online, it was still in Spanish. Like I couldn't find an English website for them.
Yeah.
And my brother is like really good on like researching and stuff. Like he's a computer science major, and like I don't know how he does what he does, but I had to send him because I was scared to take these pills because they didn't give me any sort of information really on them. And he had like had to research them and stuff like that, and it ended up they were like serious antibiotics, and he's like, "Are you okay?"
I was like, not really.
But we did the same thing in Guatemala. The air pollution was it was so severe. My asthma was really, really bad, and the girl that I was traveling with was having a really hard time as well. And they ended up giving us like pills over the counter there as well. And it was just so interesting, the difference between even just like interacting with a pharmacist there.
Yeah.
And I mean, the only other experience I have is in Canada, but it was so different.
That was so a friend of ours lives in Japan, and he said that a lot of the stuff you just get like over the counter as well, like you would kind of go to the pharmacy, but he said that like everything's like so much weaker in Japan, because like I guess their laws have something to do with it. I don't know anything about it. This could be hearsay. Go after Trevor if you have any questions. But it's interesting, even like in the EU and the UK, how different like their medications are because of their like laws around it and stuff like that. And it scares me thinking about like traveling and getting really, really ill, because for one, like when we were in Paris and we got sick, it was weird going into a pharmacy and not just being able to be like, oh, this and this, like what I normally get.
Oh yeah, because I even had to Google Translate a medication that I bought.
Yeah.
And I didn't know how to take it properly.
I know. And it's so odd. Like it is kind of like scary to me traveling and not, you can't, like, especially with language barrier, like you can't communicate with doctors properly, like your symptoms or what they're suggesting to you to do. And then like with medication, it's not the same medication across the board because of all these differences in laws. And so is it going to be as effective? Are you going to know what to even get? Like, and just like the differences in how you even like obtain medication. Like it's such a process in Canada, which is good. But at the same time, it's like, because it's not in other countries, you could just like end up taking something that's like so much more harmful to you if it's the wrong thing. Yeah.
Oh, that's what I was going to say as well. Something I noticed too about being in Central America, because I can't speak for people who obviously like live there, but I just don't think that people are abusing it the way that we as North Americans would going down there, because the hostel that I was staying in, there were people there who were getting medications that doctors here don't give out. I can't remember what it actually was, but it's stuff that like gets you high basically.
Yeah.
And they would just go in there. These weren't like my friends or anything, but people that were there. And they would just go in and ask for these medications and then take them to get high, and they just bought them.
Yeah. I wonder actually what the difference in like rates, because I don't know that the like difference in like abuse would actually be different. Like I'm curious to know that. I wish I had researched it.
Well, we can research it.
Yeah, we can. That reminded me of something that I wanted to complain bitterly about. I can't believe that it's 2020 and I can officially say that. And there's like so little in the way of like healthcare surrounding mental health and addiction. It's bizarre to me that like we know so much about it at this time, and it's still seen as something that's like not as worthy of like care as other things.
I think that the book has been opened.
Yeah.
And people are talking about it more openly. And there's certain things like even in the restaurant industry, I know a couple years ago now, there's a thing, I don't know if this is in every province, but anyway, in Ontario, where you can call in at any time and say that you have to take a personal health day, and they can't do anything about it. Like they can't fire you. Yeah. And I don't know if it's just in Ontario, but I remember it being a big thing because in shift work like that, it's really hard to get a shift covered.
Yeah.
Right. And you can call in at really any time and just be like, I'm taking like I can't remember. I think it was called personal anyway, it was basically like a mental health day.
Yeah.
And so we had to start like scheduling on-calls to deal with that, which is like where you could call somebody in, basically, instead of the other person. But I thought that that was really cool because especially in the restaurant industry, I think that there was such a lack of that sort of thing. Like even when I was like super, super sick, I felt really guilty, or I thought I was going to get written up or something like that because I was sick, and it's so hard to get a shift covered.
Yeah.
Even if you call in like right in the morning.
Well, and I think about this all the time as well. Like especially with like the hours of like a lot of walk-in clinics and stuff like that. It's so difficult, and when you're in a state of like, you know, like financial struggle and stuff like that as well, you can't take time off to go to the freaking walk-in clinic.
Yeah.
You can't even take a day off and miss that pay, let alone be worried about like losing your job because of like needing to call in for something like that. And that to me is like so horrific, because like what does that say about how we treat our citizens, you know? Like and I think that it's I think everybody can relate to like having, you know, a day where like you do need to be off work and you shouldn't be at work, frankly, just to take care of yourself, or like, you know, needing to go to a medical clinic or whatever, like for whatever. And we can all relate to that. But the fact that we expect people to not, like almost as if that's like a luxury.
Yeah.
And it shouldn't be.
Yeah.
Like that's, and it's horrifying to me as well that like things like therapy and stuff like that is absolutely considered a luxury. Like I can't imagine at like many points in my life ever having been able to afford, you know, $100 an hour, $125 an hour, $175 an hour for a fucking therapist. No. Like, and not that, you know, I don't think that they deserve to be paid less, but I think that this should be, like, why is this not being subsidized in a larger scale?
Well, and quite honestly, in Canada, there are resources that are part of universal healthcare, my brain. And my family has had experience with those therapists, and night and day. Yeah. You know, and it's sad to say because it's like generalizing again, but in my experience with my family, the therapist that I have now that I do pay for is giving me such elite care compared to the counselors or therapists that other members of my family have had to go to because they couldn't afford it at the time. Yeah. And it's just so sad. It's like, it is a luxury, and your health shouldn't be a luxury. And that's why I feel so thankful to be in Canada and to be a Canadian, because like it's a luxury for us to even be able to go to the walk-in clinic and not have it cost a ton of money. Or like if when I broke my foot, it cost me $100. All in all, breaking my foot cost me $100, whereas like in the US, I don't even know how much it would cost. Yeah. That's crazy.
Yeah. I was reading this Reddit thread that was talking about how like if you're in the US, you should ask for like an itemized bill from the hospital. Because a lot of the times it ends up bringing like the cost of everything down, because when they're not itemizing it, they can charge like $35 for a Band-Aid and shit like that. And like the one, I think I talked about this kind of recently, how they charged like, I think it was like $30 or something like that for like skin to skin contact after the mother had like birthed this child. And I'd be like, you're paying me to like hold my child. I'm paying you to hold my child. Like, it's just like, it's stuff like that that's so bizarre that they, you know, like end up charging you for. I just can't believe it. Every time I see someone post a bill from the States, I'm like horrified.
Yeah. I could really go on and on about different experiences and stuff like that because I've had so much experience with doctors. But at the end of the day, I just think that things like Reddit are amazing for that sort of thing. Like for like spreading awareness even. Mm-hmm. Like I think that people need to be thanked, or I mean, in some cases, put in their place, because there are things that like we won't accept anymore. Yeah. And I've yelled at a couple of doctors in my day. Yeah, me and that cancer whatever it's called, cancer center. I yelled at that oncologist. Yeah. And he deserved it.
I mean, that's the thing. Like, it's just like such like charged emotion. No one's going to the hospital to like have a good time, you know? Yeah. Like, so it's just like such charged emotions a lot of the time, and I don't know. Well, thanks to all the medical professionals that are doing it right.
Yeah. Honestly, it makes such a difference. Like when I think back to that nurse and I think back to my ear, nose, and throat doctor in Toronto, it makes such a difference. You laugh, but when you're so frustrated,
Yeah.
and somebody really takes you seriously, it means a lot.
Well, guys, thank you so much.
And
we'll see you next time. So sorry I cut you off.
That's okay. We'll see you next time.
All right, guys. Bye.
Bye.